Good morning, good afternoon, good evening. My name is Dr. Nelson Garais, and this is BIO112 for Laboratory Evening LPN Program, ECPI University. Now, of course, this is Vicky. We already know how to get her. And as a quick review, we get her through the cadavers menu. And then once we have the cadavers menu, we're going to focus this week on two new things, of course, the skeletal and this button right here, which is your blue dissection tool. The blue dissection tool, when you click on it, you have these 4 buttons on the right, and ignore that top button on the left and only look at those other 2 buttons. So we're going to go over each one. So the first one is the blue dissection tool, and you can see how it's like, it's like light gray here. It is, like a dark blue. That means it's activated. So once it's activated, I want to chop off a piece of Vicky's head. So I drag my finger across, and then it forms a cut line. Now, you have 2 choices. I could click on the bottom part of that cut line, and everything below the cut line will disappear, as you can see here. Okay? Now, if I want to bring it back, I go back to the blue dissection tool, and I press this button right here to bring everything back. Press the blue dissection tool again, and then I'm gonna do the same cut across her head, but now I'm gonna make the top part of her head disappear. And either way, I can then use my single finger to move her on the axis, and then you can see where you cut. Again, we could put her back, undo the cut, this button right here, and it comes back. And of course, remember our position button, and we can bring her back to the anterior view, which is then this view. This is the view we always start with in a checkoff, and this is the view that we will end with, anterior. Okay, so let's look at the other buttons. The next button here is this button right here, and of course, that's mid-sagittal. It cuts her evenly in the middle, okay? And of course, we can use our finger, single finger, and then 2 fingers to move. And then now we centered it, and then we can see all the body cavities. So of course here, you have the cranial, you have your spinal in here, where the vertebrae is, it's kind of covering it. But your spine is inside there. And just a quick little review on, remember the cervical, and then thoracic, lumbar, sacral, and of course at the very, very end, the coccyx. This is the thoracic cavity. This thin line right here is your diaphragm. It's a thin muscle that helps you breathe on inhalation. And then all here, all what I'm tracing outline with my finger is the abdominal pelvic area. Here's your abdomen, and here's your pelvic area. And you can see it's all continuous. Okay. Now, if I want to put it back to normal, I can undo the cut. And then I want to put Vicky back to our anterior position. That button. And then now we're back. Next button we're going to talk about in the blue dissection button is a coronal. That's this one. And then now it'll cut the front part of her body off. Now, if we want to look at the other side, you click this, and this one is going to do the other side. So this, before it cut the front part off, now we could see it cut her back off. And in this posterior view, you can easily see the cranial, thoracic, and the abdominal pelvic. And you see a little bit of lumbar vertebrae sticking back there with your intervertebral discs in clear view. Oh, here's another thing of note. See all that fat and that covering? Of course, that's the pericardium. And then you can see a little bit of fat here with a little bit of covering right there, and that's your pleura. Nice little review. Then, of course, I want to put the cut back. Then I'm going to get her back to normal. And then we'll try this last button. That's, of course, your transverse. Now, if I ask, hey, I want the top part, you go back here, do this, and now it only gives me the top part. And then if I ask, can we see the cut? Drag her with a single finger, axis, and now we could see. And all that yellow material is adipose. All that red material is her muscles, her quadriceps of her legs. And this is a cross section, this bone here, that's her femur. Undo the cut, bring her back to normal, and then do the position to bring her back to the anterior position, all nice, neat, and squared away. Okay. Now, another thing that we did Thursday, Unit 2, Week 2 of laboratory, we hit this button, and that's their visibility tool, and we can isolate things. And then what we would like to isolate for Unit 2, Week 2, is the skeletal system. So I can take everything out using this button right here. Remember, that circle button. And then the box, skeletal. And then it brings up all these structures. Okay. And then we're going to go top to bottom, identifying all the bones that we need to know for our Anatomage checkoff. Also look at the announcements. There is an Anatomage checkoff sample of how the procedure goes down. And also today I will also be publishing the form that you will need to print out for the Anatomage checkoff in week 3, Thursday laboratory for this particular class. And if you're watching for another particular class, it might be on another date. Another place where there's a list of like all the kinds of bones and things you need to know is also on these notes that I put on announcements in BIO112L, the laboratory part, to help you prepare for the midterm laboratory exam, which is on week 3, and for this particular class is a Thursday. Okay. Any further questions regarding the schedule? Kindly look at the announcements, our first announcements, and look at the calendar. Okay. So if we're looking at this, the skull, you have your frontal bone. Cheekbone is your zygomatic. Right here. See? That's your cheek. Maxilla, upper part. For your jaw, mandible. I turn around the sides. You can see the frontal from this point of view. And you have the parietal, which, you do it like this. There are a pair of them up top on her skull. If I change the view and I look at the posterior, there's a parietal, here's another parietal, and here is the occipital bone in the posterior view. So if I ask for occipital, you can use your orientation button to turn the patient around, or use your finger. Remember the classifications of axial versus appendicular. Your axial skeletal system is, of course, your skull, breastbone, ribs, and vertebrae, and everything else is the appendicular skeletal system. Since I'm here in the front, I already discussed breastbone. Ribs 1 through 7. So this is rib 1, and this is should be rib 7 around here. Right? Do you see they all connect to the breastbone? Ribs 8 through 12 do not connect into the breastbone. So ribs 1 through 7 are called true ribs. Ribs 8 through 12 are false ribs. Now, ribs 11 and 12, let's look at it here. You see they're not connected to the front at all. They're still false ribs, but they're specialized false ribs called floating ribs. So 11 and 12 do not connect into the front. because they are floating ribs, but they're also false ribs. So that could be a nice both A and B question. Your pectoral girdle, also known as your shoulder girdle, are comprised of your collarbone, which is your clavicle, right here. And then on the posterior view, your scapula, which is your shoulder blade. And then your upper arm, humerus, funny bone. Your forearm, made of your radius and an ulna. The radius, as you could see, is on the thumb side. The ulna is on the pinky side. The bones that is really hard to see here, right of the wrist, that is your, see this? They're kind of square. Let's see if I can get real toes. They're cuboidal. Therefore, that is your carpal bones. Then these long bones here on the back of your, or dorsum of your hand, is called your metacarpals. And then, of course, the ones on the very, very end are your phalanges. And you could see for most of the phalanges, it goes, they have, not most, but I believe all of them, have a proximal, middle, and distal parts. But phalanges is more than enough for your midterm checkoff. The appendicular skeletal system of your lower extremity starts off with your hips. You have your ilium right there. The bottom part of the ring is ischium. You can see it like this. And then the anterior portion is the pubis. You have a piece of cartilage right here, and that is your pubic symphysis. Also note that there's all this white here on the skeleton. Vicky's skeleton is also cartilage as well. And that is your costal cartilage, which are associated with your ribs. And this is your pubic symphysis, which is associated with your hip bones. Ilium, ischium, and the front part, anterior, is your pubis with your pubic symphysis, the cartilage in the middle. You also see here, this is connecting bone to bone. These are ligaments covering the acetabulum of your femur, the longest, heaviest, strongest bone in your body. And the lightest and most delicate bones in your body is in your inner ear, and those are called ossicles. We'll be going over those in week 4. Right here, near kneecap, and you could see all of those tendons there and ligaments. Remember, ligaments connect bone to bone. Tendons connect bone to muscle. And that is your patella, sesamoid-shaped bone, and that is also called your kneecap from the layman perspective. The larger anterior bone right here is called your tibia, and then the smaller posterior bone, if you can look at it this way, is called your fibula. Covered by all these tendons, it's hard to visualize, but your ankle also has cuboidal bones that are similar to your carpals, and they're called your tarsals, with these bones right here on the dorsum of your foot called the metatarsals, and of course the phalanges, lower extremity, are your toes. Big toe is labeled 1, pinky toe is labeled 5. Your thumb up here in the upper extremity is labeled digit number 1, and your pinky in the upper extremity is digit number 5. And last but not least, here in the lower extremity, sorry to be bopping around like that, that is your heel bone, also known as your calcaneus. Now, we turn our patient around, Miss Vicky, and then we're going to now look at the different types of vertebrae. The vertebrae up here, if you look at it, it's kind of thin and light. So this is your cervical vertebrae. There are 7 of them. They're associated with her neck. There are 12 thoracic vertebrae, and you could see they're a little different. They have these connections that go into their ribs. Those connections are called facets. And there are 12 thoracic vertebrae, and they are all associated with your 12 ribs. And those facets are the connections that are in the posterior. Then you have 5 lumbar, and if you'll notice this, you see this part right here is called the body or corpus of your vertebrae. And if you look at all the vertebrae, it's kind of thin, thin, thin until you get back here to the lumbar. Those, here. These things right here, they're very thick. Now, you notice on all the vertebrae, there's this white stuff in between, and that is your intervertebral disc, also known as your IV disc. IV discs are cartilage, not bone. And remember, cartilage is just like bone, but it doesn't have any minerals like calcium and phosphorus, which comprise of your hydroxyapatite. Alrighty, let me scan one more time if there's anything else we need to know. And of course, as a little quick review on how to color a bone, let's say I ask you, can you color the femur? First, you pick the bone. Then the color box lights up. I hit the color box, and then I like to hit it like in this upper corner. Because if you just, and that's where, when this all comes out, you know where that little triangle is and that upper corner? I aim towards the upper corner a little bit outside the box, and it kind of hits this. And then I could give it whatever color I want. And of course, if I want to remove the color, it goes, I press the same thing that, I press the item, and then just press the same color, and then the color gets removed. Alrighty, and then to get everything back, I took out the color. I go to my visibility button here, or visibility tool. Then here, I go to this part right here, this little circle triangle. It's a circle, not a triangle. It's a circle with a check in it, and then it lights up all the checks. We close this. And then I bring Vicky back to normal using the orientation button. And then we're all what? We're all good to go. All right, that is BIO112L for laboratory, and Unit 2, which is the second week. All right, and I'll see you in class.